The golden key for the treatment for cancers. Why does the immune cell not destroy the malignant cell? Question that arises and that should have an answer. Destroy the malignant cell. Question that arises and that should have an answer. The immune response corresponds to the defense mechanism of the organism, which discriminates the cell from the new cell. The immune system detects and destroys everything that should not be in our body. Viruses, bacteria, normal cells that have become cancerous by recognizing subtle changes that can make a normal cell a foreign cell. Activation of the immune system, beginning by contact with antigen finished by manufacture of specific antibodies. It's not our subject. Let's go on. Destruction and elimination of the malignant cell. This is what we had hoped the immune cell would do when it saw the cancerous cell. Why the immune cell is not doing its job in this case, we're going to get into maybe. First maybe. Perhaps the malignant cell does not express malignant cell receptors protected with an insulating layer. Second maybe. Perhaps the malignant cell produces chemicals that influence the activity and the lateness of the immune cell. The third may be the cancer cell is developing mechanism to escape the immune system. T lymphocyte inactivated by padlock closed by tumor K. Mechanism padlock K. Picture from Google. A fourth maybe. The malignant cell may well hide these malignant components with an impenetrable layer non-immunogenic. Its contact does not trigger immune reaction. In conclusion, the immune system became paralyzed before the malignant cell. The malignant cell multiplies abnormally, and when the zone prohibited dies, despite the presence of the immune system. So to stimulate the inactive immune system in front of the malignant cell, it must be done differently. Let's go together to see this illustration. A, B, C considered as normal constituents as self, and D, E, F abnormal particles as non-self. These constituents are well hidden in the malignant cell in its current form, and the immune system cannot identify them. Despite the fact that particles D, E, F are abnormal malignancy particles, the immune system does not attack the malignant cell. As I said before, that these malignancy particles are very well protected inside the malignancy cell. To solve the problem, the current form of the cell must be converted into a strange form against its will. Deformation is the only solution. Yes, deformation is the only solution, because cell in the current form is considered normal. Deformation of the malignant cell is very simple. By dividing the malignant cell into several parts, fragmentation of the malignant cell equals dividing the malignant cell into several separate pieces. It's a laboratory work. We can do the fragmentation in the laboratory. There are different techniques. For example, fragmentation by osmotic shock is the simplest. Concept of cellulase. Cellulase process of destruction or dissolution of a cell caused by the bursting of the plasma membrane by osmotic shock. The cells are placed in a hypotonic medium and anti-filter into them. This osmotic pressure gradient between the cell content and the external medium will lead to membrane lysis. The malignant cell is obtained by biopsy or sample. Inject the different fragments of the malignant cell into the body of the same patient by this technique. Then the immune system will fragment the foreign body into an increasingly smaller fragment from the microscopic to the atomic scale in order to identify the self of the known self and to begin the manufacture of antibodies specific to the known self. In our example, the malignant particle DAF are no longer protected by the malignant cell, and in this case, the immune system develops specific antibodies against this malignancy particle. The fragment of malignant cell enters the body. The antigen-presenting cells APC capture this fragment by endocytosis. Then the fragment is degenerated into small epitope peptides and load onto the CMS molecules. APC presents CMS molecules loaded with epitope to T cell. T lymphocyte, which induce immune reaction, cytotoxic reaction, activation of B lymphocyte for the production of specific antibodies. And thereafter the next day, the malignant cell calls in its malignant parts to use them for its multiplication or its survival, but no response for it, because the immune system has developed antibodies specific for foreign particles, which have been well hidden in the malignant cell in its initial form before fragmentation, and whose immune system has not been able to identify them before. By this technique, we stimulate the immune system against all the constituents of the malignant cell. Finally, we can have specific antibodies for the fragment of the malignant cell. The constituent considered as foreign body. Therefore, the total destruction of the malignant cell from the start of its constitution, and consequently a total destruction of the malignant tumor, its total and final healing. This technique is very good for immunocompetent patients. For non-immunocompetent patients, we make antibodies specific for their malignant fragments by injecting their malignant fragments obtained by biopsy into the body of healthy immunocompetent people of the same group. Using this technique, we will be able to make antibodies specific for the malignant fragments injected. Treatment of non-immunocompetent patient. Injection of antibodies specific to malignant particles which have been produced into the bodies of healthy and immunocompetent people. Perfusion of plasma which contains antibodies specific to malignant particles which have been produced into the bodies of healthy immunocompetent people. In both cases, do the respect of the compatibility test. Cancer treatment protocol proposed by Dr.Menad Fatiha. We will use this golden key to open the door to cancer treatment, but before getting into cancer treatment, the door must be opened with the following experience, which is the golden key. A golden key experience habit with cancer treatment. Rapid immunocompetent with cancer treatment. Rapid 1 with cancers immunocompetent. First, we do biopsy, then ANAPAD for confirmation of malignancy cells. After ANAPAD, we do fragmentation of malignant cell in laboratory. Then we inject the fragment of malignant cell into the same rabbit 1. We let our rabbit 1 in observation. After 15-20 days, we explore our rabbit 1. If we find cancer's malignant tumor is not good treatment, bad treatment, our conclusion is persistence of malignant tumor. But if we found that our initial malignant tumor has shrunk, decreased in size, it's good treatment. Our conclusion is partial disappearance of malignant tumor. So we continue treatment by fragment of malignant cell injection until total disappearance of malignant tumor. Or if we don't find cancer's malignant tumor, it's very good treatment. Our conclusion is total disappearance of malignant tumor. In the end, cancer treatment for immunocompetent rabbit with cancers is by fragment of malignant cell injection from the same rabbit. 2. Rabbit non-immunocompetent with cancer treatment. Rabbit 2 with cancers non-immunocompetent. First, we do biopsy, then ANAPAD for confirmation of malignancy cell. After ANAPAD, we do fragmentation of the malignant cell in laboratory. Then we inject the fragment of malignant cell into another rabbit 3 into another rabbit 3, which is immunocompetent, healthy, non-cancerous. We let our rabbit 3 in observation. After 15-20 days, we explore our rabbit 3. We look for projection of antibodies against the fragment of malignant cell, and most importantly, we look for side effects in the rabbit 3. Then we take our specific antibodies from rabbit 3 to rabbit 2, and after injecting our rabbit 2 by antibodies given by rabbit 3, we let our rabbit 2 in observation. After 15-20 days, we explore our rabbit 2. If we find cancer's malignant tumor, it's not good treatment, bad treatment. Our conclusion is persistent of malignant tumor. But if we find that our initial malignant tumor has shrunk, decreased in size, it's a good treatment. Our conclusion is partial disappearance of malignant tumor, so we continue treatment by antibodies injection until total disappearance of malignant tumor. Or if we don't find cancer's malignant tumor, our conclusion is total disappearance of malignant tumor. It's a good treatment by antibodies. In the end, cancer treatment for non-immunocompetent with cancers is by antibodies developed inside another rabbit which is healthy, immunocompetent of the same group. After making sure of the success of our experience on the rabbit, and most importantly, there are no side effects for injecting healthy rabbits that have been used to make antibodies to the non-immunocompetent rabbit. At this point, we can treat humans in the same way. Patient immunocompetent with cancer treatment. Patient immunocompetent with cancers. First, we do biopsy, then anapat for confirmation of malignancy cell. After anapat, we do fragmentation of the malignant cell in laboratory. Then we inject the fragment of malignant cell into the same patient. So here, cancer treatment for patient immunocompetent with cancers is by fragment of malignant cell injection from the same patient. So patient non-immunocompetent with cancer treatment. Patient non-immunocompetent with cancers. First, we do biopsy, then anapat for confirmation of malignancy cell. After anapat, we do fragmentation of the malignant cell in laboratory. Then we inject the fragment of malignant cell into another body, which is immunocompetent, healthy, non-cancerous. We let the body in observation. After 15-20 days, we take specific antibodies against the fragment of malignant cell. We take antibodies or plasma continuous antibodies from the body H, which is healthy immunocompetent, to the patient T. So here, cancer treatment for patient non-immunocompetent with cancers is by antibodies developed inside another body which is healthy immunocompetent of the same group. Thanks.